And another one of the candida that is that make this international world very alert even right now is Candida auris. I will tell you the story, the end. Yeah, what is the importance of the Candida auris, and at least we should know, especially we are in the university hospital, because some of the cases from of the university hospital will be the tertiary care, right? And tertiary care will have some very difficult cases to challenge you. Not only the medical field, but also the dentist. Because we cannot say that the patient come to visit you and they have no oral cavity. We cannot say that, right? Or they have only the oral lesion. No, we cannot say that. And as a normal flora, it can be endogenous and exogenous infection, and it can be primary and secondary infection. And can, by the nature of the Candida, the doubling time, so fast. Someone only 30 minutes is faster than some bacteria. So it can cause the acute, and not only because of the timing, but the doubling time, but also the number of the microbes. If you have a numerous number of the microbes or of the Candida, right, it will produce so many virulence factors at the same time. So it can be acute infection, or it can be the subacute or chronic infection. It depends on what? The acute, subacute, and chronic infection. It depends on which factors that have this kind of clinical manifestation. เข้าใจคำถามไหมคะ factor อะไรที่ทำให้เกิด acute, subacute หรือ chronic infection. This one you can apply to all the infection. There are three factors. There are three factors, three balances. I think everyone know that. I just come to review only. Is the pathogen, right? Yeah, because of the pathogens. And then pathogen. If they have the pathogen, it means they have another one is pathogen that have. If not, it cannot become pathogen. Host, right? When they have the pathogen, it could have the host. And pathogen and host, it has only two factors. What is another factor that you get involved? These two factors. Yes, very good. Environment. So please apply all of this to all the disease when you study. So when you study and you have the image of the pathogen, yes, which kind of pathogen? What is the growth rate of the pathogen? Okay, yes. How is the host? Innate, poor innate, right? When get the poor innate with the slow growth rate, so that disease will be chronic or acute. Chronic infection. If really poor innate immunity with the poor growth rate, which one will be? It can be subacute, right? Or subchronic. So just try to think like this, so you do not need to remember everything. And the risk factor of the systemic candidiasis, especially for the normal flora, you can apply all of this to all the disease that caused by the normal flora, like the health conditions. But one thing, especially for the Candida, is the broad spectrum antibiotics. Because in our body, especially in our intestine, we have only Candida as a normal flora or not? No, we have microbes. Population stay together. Yes. When they treated the patient with the antibiotics, so the bacteria will be decreased. When the area, we think about this room, we have a bacteria, right? Bacteria, and then we have the fungus go together. When they spray something, give the drugs to the bacteria, then the space is more, right? More space, then fungus stay together, and then fungus what to do? Fungus just keep small? No, more space, so we become more numerous growth, right? When the fungus or candida grow faster, grow bigger, what else? Candida just stay only or not? Candida have virulence factor, right? And then, not only the virulence factor, Candida have what? The skin or the cell wall of the Candida. Which part of the cell wall of Candida that can cause the immune response? Mannose and what else? B. Start with B. And the end with can. Yes, 1,3 beta-glucans. Great. You still have something, okay? Mannan, right? Beta-glucan. Beta-glucan, they have 1,3, 1,6, and 1,4. Okay. And any part of them, they have a different immune response. But the important will be mannan, and then 1,3 beta-glucan. Yes. All of this will become more virulent. So, the broad spectrum or multiple antibiotics therapy will kill bacteria. The Candida will proliferate, multiply themselves, and produce virulence factor. And it can cause the disease. So this one we call opportunistic infection. And the patient in the ICU we will call nosocomial infection. Right? And this one, what is the risk factor of the candidiasis? I still repeat the question up to you understand this point. What is the risk factor of the candidiasis, especially the invasive candidiasis in blood, in ICU? Catheter, very good. Yeah, that is another risk factor is catheter. Why catheter? Why? Why is a catheter? Catheter is also stranger, right? Candida also stranger. A stranger and stranger stay together. It become a friend? Can it? Right? It became a... Why? Why? Oh, very good, very good. Why? We almost finished Candida now. Even we just start only a few slides. อะไรวะ Catheter get into our body. Then in ICU, right? They need some catheter, right? Then we have a Candida. Multiple proliferate. Why Candida and catheter become a friend? Why it has association? Can buy the catheter. Why? You are catheter and I just can't catch.
แล้วมันก็เลยไปเกาะอยู่ตรงนั้น
Oh, okay. Your friend told me that. Thanks. Your friend told me that because the catheter is not clean. That's why Candida go to buy, right? To buy. Not clean and go to buy. You believe? Believe? Oh, please believe. Do you believe? Oh, very sincere, very good friend. Do you believe her? Oh, everyone believe that. Wow. Very interesting. We think that catheter go into our body, it will be clean or not? Maybe, right? Maybe clean, may not be. But at least before, it should be clean, right? And then it will come into they will have several good nutrition in our body. When it go into our body, you think that I try to compare. When we have some catheter or like aท่อ in some tank, just put theท่อin some the tube in some water tank, and that tank is only the น้ำประปา the pipe water, just like our body. Do you think the dirty will got into the catheter or not, the tube or not? Yes. Why? The tube still clean, right? But why the dirty thing going to attach with the tube, the surface of the tube? Oh, everyone just get away from me. Oh, they turn away from me already. Why? Because they have the biofilm, right? The candida, yeah. Before it become the biofilm, they should have some what? Attachment, right? โลภโกรธหลงลูกโลภโกรธหลง attach ถูกไหมมีกิเลสลูกกิเลสเนาะcandida have the กิเลสลูก delusion, yeah, right? The delusion or กิเลส of the candida, it means it produce the attachment ถูกไหมเป็นสิ่งที่ติดในหัวใจไปเกาะยึดติดเนาะนะนั้น it attached to the tube by produce what? Adhesin already in bacteria. Try to not, when you finish bacteria, just close all the books. No. You have to apply. Get the bacteria as our idea, foundation, our basement, to have the more increasing of the information of the fungus. Okay? It will produce what? Produce what? To attach that catheter. Biofilm. But how to become biofilm? At first, before produce the biofilm is on the surface. The basement should be, for example, this is a surface of the mucocutaneous or anticatheter, right? Then, if you produce the biofilm and you not attach to the surface, can you produce a good biofilm? No, so you have to attach first. You have to produce adhesin. Okay, that is one of the virulence factor. Produce adhesin to attach. This one can apply to mostly all of the microbes right now. In the previous time, they don't know what is adhesin. They don't know whether candida have adhesin. Cryptococcus has adhesin. But right now, we do know that. Then, at the basement, adhesin, adhere, attach like a teeth to get, okay? Then the surface produce biofilm. When treatment antifungal it can go into the candida? No, because they have a chill to protect. So we just think that this is a resistant. Actually not. So we have to delete the biofilm. That's why they try to change the dirty catheter, as your friend said. That is the later step. So they have to change to take out the catheter, especially for the patient that have parenteral route. So it means give the nutrition through the tube. การที่ให้อาหารทางหลอดเลือดอะค่ะ So that is to have a high nutrition. That's why they have to change the catheter quite often and clean. Any addition? เติมอะไรไหมคะ Okay? So now we have, so biofilm, we protect, kill it out. Okay. Now at the basement, At the basement, attach. So you think that when we attach, we will just only attach? If I'm a candida, and if you are candida, are you going to attach only to the surface? No, so what else we are going to do? Proliferate and then produce biofilm. Invade. That's why we call invasive candidiasis. Okay? It can be invade in the form of yeast cell or the hyphae or pseudo hyphae. It can be any form. Depends on the species of the candida. When it invade, how can it invade? How can they invade? Candida doesn't have the hand to open the gate, or doesn't have the hands to, or have any clue or corn to knock, 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 knock. I want to invade into the skin. So how can it invade into the skin? How can it invade to the organ? Yes, because candida need to grow. Right? How candida need to grow? Which nutrition it can be? Normally, fungus will produce extracellular enzyme. And the extracellular enzyme is one of the virulence factors. Right? To produce phospholipase, produce proteinase, hyaluronidase to digest the cell. Then the cell have some trauma. Right? Then normally, so just like a screwdriver, go inside. Okay, so now you do know how it become the pathogenesis. Anyone get that? Are you okay? Are you okay? You get some story? No. It's okay, it's okay. Now, right now it might be too much information. You just go back and review all the slides. So this one you can see the host defense mechanism. And this is some of the pictures of the mucocutaneous infection. Yeah. One of, because you will be the dentist, right? So you have to differentiate candidiasis in oral cavity from the diphtheria infection. How you differentiate that? Because most of them, they have a white thrush, right? The white patch on the tongue. So how you differentiate that? You will swab from the oral cavity. If the candida, it will be not attached too much, right? It's very easily to scratch out, to get the gram stain or get the white wet mouth. So candida, as a normal flora of this sexual area, so it also can become the candidiasis for the small baby or for the lady here. The cutaneous infection, one of the cutaneous infection is quite differentiated from the dermatophytosis. What is the difference? No. What is the main typical of the dermatophytosis on the skin? Or tinea capitis? Tinea corporis. Because you have to know the tinea corporis, then you can differentiate from the cutaneous candidiasis. So when we study, we have to compare. If we remember only one part, then we don't have another balance. It will lose very easily. Tinea corporis will have the active border, right? Some very red, circular, something like that. But for the cutaneous candidiasis, it will be like a vesicle the small vesicle around here. You can see in here. You can see your slide is much better. Small vesicle a lot. Yeah, surrounding the big vehicle like a ยานลำใหญ่ and this one have a very hot flush okay คันแล้วก็ปวดแสบปวดร้อนมาก whereas dermatophytosis doesn't have ปวดแสบปวดร้อนโอเคไหมจะคัน and how to get the specimen just use the scalpel and touch the surface of the vesicle. Then you can do the KOH preparation or you can do the gram stain. Okay? And normally it will be surround or it will happen in the a lot of muscle พูดไม่ค่อยสุภาพตรงที่มีเนื้อเยอะๆอะค่ะนะที่มีรอยพรับเช่นใต้ราวนมนะคะจะมีตรงนั้นน่าจะเยอะนะ And how about the paronychia? Dermatophytosis doesn't cause the paronychia. Paronychia, what is a paronychia? Surrounding of the nail. Yeah. Dermatophyte will not cause a paronychia, but Candida will cause paronychia. Like this picture here, the red surrounding the nail. And also it can cause โรคผ้าอ้อมกัดค่ะ diaper rash in the baby. And with the high technology and of the study of the genetics, now many cases of Candida granuloma caused by the genetics abnormality and have something about the bad immunity from the root site. And not only cutaneous and subcutaneous, everywhere in our body can cause the disease by the Candida, endocarditis, meningitis, septicemia, iatrogenic candidiasis. Do you know what is iatrogenic, right? Do you know what is the meaning of iatrogenic? โรคบุคลากรทางการแพทย์กระทำ we call this is โรคของแถมเวลามาอยู่โรงพยาบาล no? And this disease is quite the big problem, especially for the poor infectious control system. So whenever you have you go to treat the patient, try to have the good infectious control, okay? Because you are one that can bring one disease from one patient to another that you don't want to be. Invasive candidiasis, the mostly is bloodstream infection. And it can cause from one organ to another organs, not from one person to another person. But at the same time, the bukalakon, the medical personnel, can bring and can make the nosocomial infection, especially in ICU. And this is the fourth most common disease in US. I think not only in US, also in Thailand too. The symptom not specific at all, never specific. After wrong treatment with antibiotics, and it always disseminate to other organs. So whenever they have a non-specific, they have to try to think about the catheter. The patient still have the catheter for a long time. That's one thing. The second thing, treat with the antibiotics too much or not. Sometimes they have to quit, to stop, or to switch antibiotics and see the symptom of the patient and to check the urine. The high risk ICU surgical, very low birth weight infant, and still the problem even in USA, iatrogenic infection. Now host Candida, right? The host, because of the surface molecule, permit the adhesion. And for the Candida, Okay? Environment, it means, for example, I will give you the example in here. Yes, we already passed, okay? We already talked, we already discussed with this slide. And this one too, you already studied the cell wall of the Candida. Yeah. And which part of the Candida? Oh, I might, do you already study about the diagnostic already? Yeah. So I can ask one question. Yeah. We just review, okay? Here, what is the violet part? Is the mannane. The green part is beta-glucan. So when the patient suspected that they have a fungal infection, they have which kind of serology that we can test whether the patient have candidiasis or not. The sample will be serum. The suspected infection will be fungal infection. The test will be serology. So which test of serology you would like to try with this serum that patient suspected as fungal infection in ICU? The patient stay in ICU for 2 months already and have the fever sometimes and have treatment with antibiotics. So which test? Serological test, which part? Okay, if you cannot remember, cannot remind, which point you are going to test? If you think that this might be Candida because stay in the ICU for a long time, treated with the broad spectrum antibiotics. From this slide, you think that which part of Candida it will be useful for us to test? Because Candida, we suspected invasive candidiasis, right? Candida in the blood will grow or not? ตะโลโตถูกไหมคะ will grow. So when the Candida in the blood multiply, they will have the spirit of the Candida cell wall released in the bloodstream. เข้าใจไหมคะตรงนี้ เข้าใจไหมพรีมเข้าใจไหมโอเค when they release in the bloodstream, so which part of the Candida will be our target to test? See this slide. I'm still in this slide. What? Try to help please. Yeah, yes, good. Cell wall. Which part of the cell wall? They have the chitin, they have a beta-glucan, they have a protein, they have a mannane, they have a beta-1,2,1,6, they have a 1,3, they have a 1,4. 1,3, they have only one right now, beta-1,3 glucan. Need to test. And other thing is, what? If they don't have the beta-1,3, because in Thailand, only one laboratory that have the beta-1,3 glucan test is in my lab. So it's over there. So how can? What is another choice? Oh, everyone, just help me, please. Look at. Mannane. Okay. Now they have two commercial kits. They have one is mannane. Okay. mannane and anti-mannane. Then we have beta-glucan as antigen test. Normally, for fungal infection, yes, with the poor antigenic properties of the fungus, so we will test antigen, not antibodies. Normally, you will test the antigen, okay? And the antigen test, we can use antigen of the part of beta-glucan, 1,3 beta-glucan, and mannane. But mannane and anti-mannane together is not so good. Yeah. The sensitivity and the specificity is still poor. Okay, you do know what is the good part of the cell wall, right? Cell wall, it can stimulate, it can trigger an immune response, right? Then it will be the good target for drug development. Which kind of เรียน pharmaco ยังคะเอาเรียนตอนบ่าย Okay, the cell wall of the fungus, especially the beta-glucan, is one of the important target for the drug development, like we call candin, something that din, cell wall can din, right? Din ไปดิ้นมาเนาะ That's why the name of the drug we call candin group, like an echinocandin. Okay. Now this is you already studied in immunology. And candida can cause several parts of infection, and each part of the infection have the different immunity to response. So you can study from this one. It might be too much in detail to take the examination, but it will be very useful for you in the future. So that is the pang, right? The map, and this is the explanation to make it simple. And this is in Thailand. There's show you the epidemiology of several species of the Candida in 1 year. In Asia, 25 hospitals. The yellow will be the Candida. Yellow is Candida tropicalis, I think. The good part, this is Candida albicans. This one, actually, I would like just to show you different part, even in India, the same country, but different species show you. In Thailand, here, the same pattern of the different species. In Thailand, Candida albicans are the first population, followed by the Candida tropicalis. In the near future, okay, Thailand have more aging people. You know aging, the old people. More old people. Then the population of the species will be changed from tropicalis to Candida albicans, then Candida gravata. Which Candida gravata is one of the minute Candida and have the very aggressive virulence factor and aggressive clinical manifestation, and very hard to treat. Just show you the ward. The medical ward. This is from the 25 hospital. Yes. Mostly is a medical ward that have most of candidiasis. Then intensive care unit. Then the surgical. Because normally the surgeon doesn't like to consult with the infectious disease man. And the one who is going to be bad is the patient. Here. 3 parts of this one. And then in the near future, the trend will change into the hematology here. Because of what? Because the high technology of the treatment. Right? Because you are going to give more steroid. When you give more steroid, innate good or not? Innate not good. So the patient will become more and more. So we need the balance of the treatment. So how we diagnose? By gram stain, wet mouth, or KOH preparation. Culture, we use just a common plate, like a blood agar or Sabarot-Dectos agar. Candida albicans can grow with the cyclohexamide. You know what is a cyclohexamide? Okay, no. Cyclohexamide is the anti-saprophytic drug. Might be forget. Yeah. So Sabarot-Dectos agar, you know, right? อาหารสับปะรด How to remember the name? Sabarot is a French professor name who create this medium. So Sabarot or Sabarot-Dectos agar with antibiotics. For example, penicillin, streptomycin. Okay, this one will. Okay, when you get the sample that from non-sterile site, for example, oral cavity, from the urine, doesn't have only one microbe, right? So you need to put the antibiotics to kill the bacteria. And at the same time, Candida, several species have the profile pattern to cyclohexamide in differently pattern. Cyclohexamide, รู้ไหมอะไรคือ cyclohexamide? Okay, this is one point when you get the specimen medium with antibiotics when you have the non-sterile site sample. Then from the urine, normally the doctor will send you the urine. For the urine, we say that 10 multiplied with 3 CFU per ml. Okay, this is 3 times, but this is not typical. Okay, even in the textbook they say that if you get it 3 times of this amount, it means that you need to start treatment. But it doesn't mean like that. Actually, in practical, it depends on the patient. Yes. If the patient still have the treatment with antibiotics for a long time, yeah, they can get normally for this amount or over. And you have to get even it depends on the status of the patient. Like if the patient are the DM diabetes and get this kind of the amount, it might be unnecessary to treat. Okay, so it depends on the infectious disease man to decide which kind of status of the patient. And this picture you can see here. You can see here. What is this? This is gram stain. Oh no, this is okay. This is a no, it's a GMS. You know GMS, right? It's a histopathological section and stain with the carbohydrate on the cell wall. These are budding yeast cell, and these are pseudohyphae. It's a lot in here. As I told you, Candida albicans are the normal flora, and there are several non-albicans. So the easy way to differentiate is to differentiate Candida albicans. The 3 points now it decreased into 2 points. Yes, one is germ-2 test. The germ-2 test of the Candida albicans, we call Reynolds-Brown phenomenon. The condition will be in 37 degrees Celsius, in serum or in nitrogenous base. Then within 2 or 3 hours, it needs to be very strict in this criteria. And if we saw that under this criteria, we saw the germ-2 like this, the small germ tube, the small hyphae protrude from the cell. Even 10% population, we say that this germ-2 positive. almost 90% of the Candida albicans will produce germ tube formation. The second one is the chlamydospore production. This one we need to induce the chlamydospore production or the morphology of the yeast by growing on the carbohydrate high carbohydrate plate. Like we use the sticky rice powder, the flour, แป้งข้าวเหนียว and then we put some agar and put some T18 to induce the fat quantity and narrow condition. And we can observe when we streak the Candida on the surface of the plate and cover with a cover slip. Then we can see here some cells are very big, bigger than the budding yeast cell. You can see here small budding yeast cell, and this is very small. Whereas this chlamydospore. Chlamydospore, we call the chlamydospore by the meaning of big cell. Not only big, but the cell wall also very thick. Okay, so we can differentiate. And the location of the Candida will be at the top. Okay, at the top of the hyphae. So two criteria. One is germ tube test, another test is chlamydospore. And another one in the theory is sucrose assimilation test. For the chlamydospore, Candida albicans, dubinensis, and tropicalis will be positive. But germ tube mostly will be Candida albicans. And we can differentiate between Candida albicans and tropicalis by sucrose assimilation. So now, conclude with the definite criteria. Direct examination, culture, serological test. Not only that, we need the clinical symptom together to decide how to manage, how to treat the patient. And this can pass. I just mentioned a little bit to get you not out of date. Candida auris. Candida auris is another Candida that makes all the alert of the infectious control in the world. Actually, Candida auris started from 2009 in Korea. They isolate the Candida auris from the ear. But after that, it spread, not spread, but it has the case, in here, in US, in India, in South Africa, in several areas. And after they do the phylogenetic tree, they divided into a different group. So they still have no idea where this Candida auris come from. We have, in Thailand we have one case. Fortunately, very good luck for us that we have only one case. Then, and what? How we have to alert, how we have to aware. Because this Candida auris, in some certain country, not all the countries, okay? Especially in US, they have the multiple resistant drug profile. That's why they make all of the international have to alert. Because they think that they are the biggest country, right? But this is quite good to make us alert, really very careful of this Candida auris, especially Candida auris. They found that they can you read that? Where is the Candida? Where can it be found? It can be found in normal flora. It can be found in the urine without any disease. But unfortunately, this Candida difficult to identify with the standard laboratory technique. It need to use the sequencing. And also right now they already have the profile of the protein. that can identify using the mass spec multitoph, the protein profile. But in Thailand still have the problem, so we need to use the sequencing to identify. One thing. Another thing is that Candida auris can be the healthcare setting that have the outbreaks. Like a rapid identification, need to be really careful, need to be really alert for that. Whenever we identify or we suspect that it's a Candida auris, we have to separate the patient into an isolated room. And all the dress need to be separate also, need to be disposable, because it is very easy to spread and very difficult to kill the Candida auris. That is why we have to really aware of this infection.